We're live. Hey guys, welcome. That took me by surprise. Hi everybody, welcome back to Ask Away Health. Welcome to the very first live stream of the year. It's the second Sunday, isn't it? But I missed last week because life happens. But yeah, it's so good to be back with you guys. Happy New Year again to members of our community. I know we've exchanged greetings on the community, but this is the first time I'm seeing you guys live. So happy New Year. I hope you guys are doing well. And you're very much welcome to tonight's video where we are doing a live Q&A. And in particular, I'm going to be going through some of the amazing comments and questions that you guys have sent to the channel, and if there are any that come through live tonight, happy to tackle them as well. And as always, my plan is to just give you general insights into different issues to do with health, into the questions. I'll just put up my disclaimer here just to remind you that it is not specific medical advice. You always need to go back to your general practitioner for that. But it will be general information that hopefully will just guide you and help you have a conversation or start to have a conversation with your own doctor. So welcome. If you're watching on Facebook, LinkedIn, on YouTube, please give this video a like, and of course do consider subscribing to the channel. So two major things that we're going to talk about in terms of the questions. I've just decided to stick with two different topics so we don't dance around the whole women's health issues to do with women's health all evening. But we're going to be looking at fibroids, and we're going to be looking at vulval or vaginal lumps or irritation or things to do with that. So if that's something that you've got a burning question around and you want to sort of engage and get some thoughts around it, please feel free to use the chat, send in your question. But let's get started. So the very first one, we're going to start with the vulval vaginal lumps and things to do with that. And then I think midway we'll just sort of switch to fibroids. So let me put up the question so that you're reading along with me. I haven't got too many graphics today because I just didn't have the time. But let me start. This is an important one. Don't forget to like the video and subscribe because I always forget to put it up. But let's go to the very first question, which is this one. So I'm just going to leave that on here while I read it out, and then we'll sort of think about it together. So someone says, I've had a very hard lump, and please excuse me if I'm looking that way. It's just to make sure that I'm keeping track of what's happening on YouTube. And by the way, I do have a poll that is going on YouTube, so I'd love to get your thoughts on the poll question. Let me see let me just remind myself. Hang on, where's the poll? If I can't find it now, I'll look for it during the break. But I have a poll that is going on, and I also have a super chat goal. So if you really feel keen to bless the channel, fine, please, help me meet my super chat goal. I'll look for that poll during the first break, and then but if you see it before me, please make sure that you sort of put in your thoughts on the poll question. It has to do with fibroids and the most significant fibroids, and remember it differs from woman to woman. Okay, first question, let's go. I've had a hard lump in my vulva close to the urethra for about 4 months, and it's invisible unless touched. It's painless, but now it starts paining me after sex, and I feel the pain in my thigh. The doctor said it's an external polyp and it will disappear on its own. So I couldn't get all the questions to fit into the space for that banner there. But yeah, the question is, I've had a hard lump in my vulva close to my urethra for about 4 months, and it's invisible unless touched. It's painless, but now it starts paining me after sex, and I feel the pain in my thigh. The doctor said it's an external polyp and it will disappear on its own. So we're sort of, thinking, what could this be? And guys, I'll refer you to one of our most popular video on the channel where I talk about different types of vaginal lumps. I will link it to this video in the description later. So if you haven't watched it, it's really worth watching just to educate. And in fact, there are a couple of other videos as well where I discuss vaginal lumps. But this one close to the urethra. So the urethra is the opening of the bladder opening to the outside. So that's where, for women, you urinate, and it is, within the vulval area. So this lump that's been there for a number of months, could be pretty much a number of things. And of course, without examining, it's a bit tricky to say specifically what it could be, but we're sort of going to have a look at the possibilities. Now, it's close to the urethra, so whether she has any discomfort when she's passing urine, I don't know. Although she said it's invisible, so you can't see it unless you sort of go feeling for it, you can't see it. So it's a few things that it could be. Her doctor said to her that it's an external polyp. Now, a polyp is it's a small growth of tissue. So it's the name that we give to any growth of tissue. You could develop a polyp anywhere. So it's like a firm piece of tissue that grows out from one part of the body or the other, and it could be benign. And usually what we do is if you think it's a polyp and it's not particularly causing any trouble and it's not getting bigger, the initial assessment or the initial outcome or advice your doctor might give you will be, right, let's just keep an eye on this if it's not causing any problems and see how it goes. And they may do this for a few weeks or a couple of months and get you to come back to review things. But in this case where she says that it's hurting her after sex and she feels pain in the thigh, so it looks like it's causing some problems. She said, which doesn't come up on the screen for you now, she said the doctor said it's an external polyp and it will disappear on its own. Well, we don't know that. Obviously, the doctor has the advantage over us because they've seen it, and so they sort of assuming that it might just settle, perhaps it's as a result of some inflammation and that it will calm down after some time. We don't know that, but I suppose it could be a cyst. That's something that it could be a cyst. If you want to think about something like a Bartholin's gland cyst, and again, I've got videos around Bartholin's gland cyst on the channel, so please feel free to go and check those out. I will also link them in the description box once we're done here. But some Bartholin's gland cysts can develop and just remain a small size for a period of time and sometimes settle by themselves as well, without you necessarily having to do anything about them. Of course, some other types can get infected and grow and cause really horrendous problems and do that over and over again for some women as well. And of course, the other thing that we could think about is an inflammation or infection of the skin's glands, which again, I've got a video. The skin's glands are tiny structures close to the urethra. So I wonder whether this is what she has. They don't generally cause problem, to be fair, especially if they get infected or if they get inflamed. It rarely happens unless, they do go ahead to get inflamed or infected or irritated. When they then get bigger and then you actually discover, oh, there's something like skin's glands present. So there's a few things that this could be. Bartholin's gland cysts, skin gland cysts, simple cysts, not necessarily of the Bartholin's gland, other benign growths. And I say benign because she says it's been there for some time and not really caused any problem. However, now that there's a change where something different is happening during sex or even outside of sex, she's getting pain going down into the thigh, probably a good idea to go back to the doctor with these new symptoms that have developed to sort of have a look at what might be responsible and have a think about, do they need to do any further tests? Does she need to be referred to the gynecologist? Does she need to have a biopsy if it's growing bigger? Because it's recently become painful, it's not unreasonable to consider treating it perhaps with a course of antibiotics, depending on what the doctor finds when he examines. So there are a few things to think about here. I think the most critical thing, so I've sort of shared with you what I think will be responsible, but I think what's most important, because like I said, I haven't looked at it and we're providing general advice here. I think it's important that she goes back. It's one of those lumps that you don't want to just, ignore and tolerate the pain. The pain is suggestive of something, and that pain might signal there's some irritation or inflammation or infection, or it's gotten bigger, so perhaps it's pressing on some nerves close by. And so that's why I think it's important to go and sit down with the doctor. I think the key takeaway here is that this is a lump that you've had for some time that now appears to have changed in some way, which is causing pain. And so you should report back to your doctor to have a look at it and guide you on what the next steps should be, whether it's a trial of some type of treatment, whether it's to carry out further investigations. That will be the next thing to do. So thank you so much for that question. I think that was really a good one to get us started for tonight. If you're just joining, welcome. Please give this video a like. Thank you so much. We're doing our live Q&A for the New Year live Q&A, which I should have done last week, Sunday, but I couldn't make it. And it's just gathering a few of the really interesting questions or popular questions that have come up from viewers of the channel. But if you have got a question and it's related to the subject that we're discussing, so we're talking about fibroids, we're talking about vulvovaginal lumps, you're very much welcome. Happy to look into those with you. So I have hello, Sister Zeha. Thank you for joining. I wonder where you're watching from, but thank you so much. And you've popped a question in the chat for us, which this is a good time before we go on to the next one. Where you're watching from, but thank you for watching. Please give this video a like. Keep having huge pimples in my inner labia and I don't shave. Everything online says it's from shaving. Huge pimples. Again, this is a good time to thank you so much for joining from Brooklyn, New York. Nice to have you on. So I was just, before you sent that, I was just about to pull up my, where is it now? I was just about to pull up my disclaimer. Do you know StreamYard have recently changed their they've recently changed their layout, so things look a bit different, so it's going to take me some time to get used to. So disclaimer, no diagnosis, but I like this question. I think it's a really interesting one, and I think it's not uncommon. So huge pimples could signal lots of different things, and you're right, it may not necessarily have to do with shaving. I think I would like to think broadly without seeing this. And of course, I would recommend that you see your doctor to not just examine you, but take a good history, find out about your medical background, because there could be certain conditions that may increase the risk of this happening. But something that comes to mind is irritation, perhaps from products, personal care products that you use, that may lead to this happening frequently, causing irritation of your skin and giving rise to these pimples, because they might first start as rashes, that the skin is sensitive to something. And over time, just given the nature of the area, being warm, being moist, there's an increased risk of an infection. So that's a possibility. The other possibility, even though you mentioned that is the inner labia, is something called folliculitis. It's possible that you could have hair close by that gets irritated, and we're not talking about ingrown hair or so to do with shaving. No, I'm not referring to that. You could still get infection of the hair follicle. The inner labia tend not to have any hair, but just in case, because again, I haven't seen it, but just in case, we're sort of talking generally about conditions that could affect that part of the body. You could also have hair follicles that get infected, and not because you've shaved, simply because of irritation. So the first thing I would recommend is, you need to have to see your doctor. You said you keep having these symptoms, and I don't know how long they've been going on for. But some people have a tendency to keep having spots or boils or things like that, for example, if they're diabetic. I'm not saying that you are, I don't know, we haven't talked about that, but I'm just giving that as an example of one condition that can cause that to happen frequently in some people, in some diabetics, not everyone, and usually because the sugar level is not controlled. So I think that looking at the personal care products, perhaps a degree of sensitivity or allergy. And even before you see your doctor, even though I urge that's the primary thing, but even before you do that, you can also start keeping a diary and perhaps start excluding certain creams or fragrances or wash powders or things that you use, to see if that will make a difference. I don't know if you've tried that or not yet, but that's probably something to do. That will be the next step after you book an appointment to see your doctor, to consider are there particular products that you're sensitive to. And then the other thing is, at what time, depending on whether you're still having your menstrual periods, around what time of your cycle does it happen? around what time of your cycle does it happen, and things like that. So, I mean, I'm just going to put this on the screen, and thank you for being, sort of frank to share this with us, because I think it's helping to educate. So you mentioned that you're diabetic and hypertensive, and you've had a total hysterectomy. So again, I would, and I'm not saying that it's because of your diabetes, I don't know, but I think it's something to consider, because sometimes we do see some troublesome boils or infections that keep coming back in people who are diabetic because their blood sugar is not well controlled. Sometimes that's what we see. The fact that you've had hysterectomy, we also need to think about hormone levels, because sometimes your hormone fluctuation or imbalance could affect the tissue in that area. And so that could increase the risk. That could change the skin, that could change the way the skin behaves. That could make the skin more susceptible to getting these kind of sores or getting these kind of recurring problems. So I think we have covered the very first thing, doctor's visit, if you haven't done that already, number one. But in terms of considerations, just giving the descriptions and the background that you've provided to us, perhaps some irritation to products that you're using. And it's not just personal care products, also clothing. So, we should have a think about that. Then we've talked about the possibility of, diabetes. We've talked about the possibility of infection or inflammation of the hair. We've talked about hormone imbalance, given the fact that you've had a hysterectomy. But I would say even for people who have not had a hysterectomy, who may experience something like this, if you look at when does it happen, which part of your cycle does it happen, the first half of the cycle or the second half of the cycle, it may have something to do with hormone imbalance. So those are the thoughts I would have around that. Thank you so much, Sister Zeha, for sending that question in and comment in. I really appreciate it. Very interesting to sort of think about it. But I think, given that you've experienced it and it seems to have been giving you problem for some time, that you should see your doctor. So you say, should I make an appointment for the hormone level? I would, first of all, I would suggest seeing your primary care physician, because we tend to look at things from a broad, how do you put it now? From a broad base, if you like. So we're thinking of quite a few different things. Eventually, you may get referred. You may need to be referred to a gynecologist, or you may need to see the gynecologist if your PCP figures out that it's not because of allergic irritation, or it's not because of the diabetes and so on. And then they can guide you to that. I would really strongly expect that they take a good history, understand, what have happened in your lifestyle that might have brought this on. For example, when it started, what kind of thing was going on around you, and then examine to have a look at what you're describing, and to be clear which parts of which organs are affected, and then have a conversation. Is it something that they can treat, or is it something that they can then refer to the specialist for? Would be my suggestion. But again, thank you so much for putting that question. I appreciate that. So let us tackle the very next one, and I'm just going to share that on the screen for you guys to read along with me. And I've just literally just sort of put the question as it came on. I don't think I've tried to audit the question or anything like that. This is really how it came to me. And I think it's best, because then, we can sort of work out what the person is trying to say or what they've experienced. And that's why, I've shared it with you just as it's provided to me in the comment section. And of course, so that we can try to understand. So this says, help please. I have a hard thing in my vagina. When I put my finger in, it moves. So, okay. As I read this, I realized that there's some people who are going to see this and start thinking of all sorts of crazy things. Let's keep it clean. Let's keep it very clean. We're trying to look at health conditions that could affect people and how best to help. So I think this can be quite worrying. When you can feel something within the vagina, and you don't know what it could be. Different questions come to mind in this case. What kind? She's feeling a lump clearly within the vagina. How big is it? I'm wondering. Is it painful? There could be different things. They could be benign, in which case, it's not cancer. For example, cysts or even a type of fibroid. You know, there's something called a cervical fibroid where the fibroid is going sort of from the neck of the womb and is going down into the vagina. So that is possible to happen. And in this case, we're not sure. I think it's really, this one is one that there is not much to say until you actually see it. This is one that you simply have to go to your doctor, get them to, after doing all the question, after doing all the history taking, then a good examination to see what this is, to work out what is going on, because we can sit here and talk about the different possible causes. So I would say I would just recommend a visit to your primary care physician or general practitioner or gynecologist, because you would need to have a physical exam or scan, to identify what's the cause. So we could sit here and say, oh, it could be this, that, or the other. It could be a cyst, it could be some type of an infection. I don't know. This one is hard to say. There's not very much information. This is literally how it was presented to us. So I would love to hear from you guys. If you were faced with something like this, what would you think? If you're watching and you come across this kind of experience, what would be in your mind? What would you be worried about? Something that is like a hard lump, and when you put your finger in, it moves. So it's not something that's sort of fixed. She can move it. So it's just something that's maybe growing from either the walls of the vagina, or, like I said, coming from the opening of the womb. Again, we can sort of sit here and question, but we're not sure. So to my original poster, to the person who presented this question, I think I probably have answered this already in the channel. I would check and see if I haven't. I would recommend that you see your doctor about this. This is not something that we can sort of waste time. And I think it is not. It might be a cyst, which is benign, but it's really your vaginal canal is supposed to be a space that's free, supposed to be a free, open channel. So if something is growing within there, then within that area, it's not supposed to be there. So it needs to be looked into. Okay, so right, we are doing a New Year Live Q&A where I'm answering questions that I've been getting from my channel watchers. And thank you so much. I get lots of amazing comments, and not just to videos, to my community posts. And I really want to say thank you. If I've not had the opportunity to say that to you guys throughout last year, thank you so much for being so engaging. I'm looking for more engagement. And in fact, one of my challenges this year, one of the goals I've set for myself is to grow our Ask Away Health community and build a newsletter community. So if you don't know, I have a newsletter, and again, I will put the link to that in the description box, and I'm hoping that we can grow to about 1,000 by the end of this year, and I know we can do it. So I'm going to be very vigilant about trying to promote this. So you're going to hear about this on my videos. So if you haven't joined the community, the newsletter community, please join. I will share the link in the description box. But for now, we've tackled 3 questions. Very much thanks to Sister Zahab. I really appreciate your popping in that question. I think we learned quite a bit from that. Let's take a quick break. Let me see if I can find. Honestly, I don't know why these guys changed this thing around. Okay, let's take a quick break. And then when we come back, we've still got a number of questions around vulval vaginal issues. And then we're going to tackle fibroids as well. I'll see you in a second. Okay, back. Okay, welcome back. Thank you so much. Sisters, I have put the newsletter link in the chat. So if you click on it, you see that there are a couple of different options. There's a free version that everybody can join in, and then there's the other subscription options. But yes, happy to have you on board. And again, thank you so much for the questions. Okay, guys, welcome back. So we're going to continue with our questions for tonight. Let's go on to the very next one. That's another long one, so I couldn't get the entire question showing. So let me read it out to you. So this says, I got my period a few days ago. Suddenly, I felt bumps around my outer vagina and anus. At first, I thought they were pimples, but now there are many with white pus and a little blood. They're painful. I can't sit or walk, and even water burns. I'm using antiseptics, but don't know how to cure this. So yeah, they're painful. So I couldn't get the entire question in for you guys. So they're painful. She says she can't sit or walk, and even water burns. I'm using antiseptics, but don't know how to cure this. So this sounds really painful. You know, you guys, as we're reading this, all of us can sort of feel how uncomfortable this must be. It sounds really uncomfortable. And there could be lots of different things. So this one is, and this came up quite quickly, didn't it? This happened, yeah. Got my period a few days ago. Suddenly, I felt bumps around my outer vagina and anus. Again, and I'm going to keep doing this just in case people are just joining and just wondering what we're up to. I'm putting this disclaimer on here because I want you to be conscious that what we're doing is providing health information, general health information for people, and we're not giving specific advice. I always encourage you to go back and see your medical practitioner so that you can be properly assessed, so that you can have a thorough history taken, a detailed examination before we come to any diagnosis. But what we can definitely do here is have a conversation around possibilities, and, you know, if people are interested in learning about what could have caused this, or, you know, sometimes you forget to ask something at the doctors. But anyway, you know, we're dealing with this one in terms of providing general health information. So this, like I said, somebody got their period a few days ago, and then they developed these bumps around my the outer vagina. There are a few things that come to mind when I think about this. I mean, clearly, because it's painful, she's talked about pus and a bit of bleeding. You will be thinking about an infection, and I am too thinking about an infection. Wondering whether it has to do with her hair follicles that have gotten infected, or whether it's an abscess or abscesses that she's developed. But also, and because she talked about burning, I'm thinking about herpes infection. Which is a sexually transmitted infection. Now, don't forget that there's lots of information that we don't have here. And the kind of things that your doctor would want to ask you are if this kind of thing has happened before, if you have any sexual partners, if you have any similar bumps anywhere else in the body, and other symptoms. But I think just giving the little snapshot that we've been provided about this here, it does suggest that there's an infection going on. And I would really encourage this person to see their doctor as soon as possible. I'm not really happy about this antiseptic business. Because if you're using the antiseptics without knowing what the cause is, antiseptics are not going to treat a bacterial infection, and they're not going to treat herpes either. So they're not really doing anything for you. In fact, they might even irritate the area further. So it's really important that you're seeing the doctor as soon as possible, really very quickly, really urgently, particularly if it's very painful, if it's affecting your day-to-day activities. You know, you can't sit, you can't walk. You know, I'll definitely recommend that. So if it is an infection, if it's a bacterial infection like folliculitis, then they might give they'll give you some antibiotics. If it's herpes, then that's antiviral. So that will definitely be the way forward. I think to get between when you see the doctor and, now, avoid wearing anything that's too tight. So avoid tight clothing. Try and keep the area dry. So make sure in between bathing, in between using the toilet, make sure that you avoid being too sweaty and damp in that area, because of course that would worsen the symptoms. And definitely avoid trying to pick at things and trying to pop them or squeeze anything, because you could spread it, or just it could just make it more, spread the infection, or just make it more uncomfortable for you. So that's my thoughts on that. Again, happy to hear from you guys what you're thinking. If you've experienced this kind of thing before, this would be very, very uncomfortable, really, really uncomfortable. I can only imagine how they would feel. But those are my thoughts about the possibilities that are going on there. Okay, so Sister Zahab says, is it through the seller shop? No, I've just put it on this chat because I didn't have the chance to put. Oh, I'll start. I hope it shows as a start. I've started on StreamYard, so I hope it shows as a start. So this is the link. It's askawayhealth.org/pricing, or if you go to Askaway Health, which, let me open up Askaway Health. Let me open up our website, and then I can share with guys that are on this, who are on the live stream with me now. Okay, so let me share my screen, and I'll just quickly talk you through Askaway Health. Yeah, okay, so this is our website. Where am I? Okay, so this is our website. So I think you can see. So that's our website, askawayhealth.org, and it is a database, health information. Some of my videos I put on here as well. I do a lot of discussion, a lot of conversation, a lot of blogs and stories about different health conditions. So if you go straight to the blog, you'll find the different topics that we put out on a weekly basis. So there are quite a few things that you can sort of read through. I've got lots of different topics that show up on the blog, and it's all women's health and some family health, children's health related issues, but we do cover quite a lot of different topics on the blog. We've also got a free symptoms checker. So if you, for example, this person with these symptoms that we've just been talking about, the painful bumps and things, you could put them in our symptom checker, and then we could sort of go through and then give you a list of possible things it could be. Sometimes if the possibilities are quite wide, then it's difficult to narrow down, but we have this free checker that allows you to put in different symptoms, and we can come up with a suggestion of what it could be, and usually with guidance as to, you need to see the doctor about this. So that's our free symptom checker tool. We've also got other services like digital concierge, where you can contact us for one-on-one conversation to chat around different conditions. So that's the concierge service here. But yeah, I was talking about the newsletter, which is on that very last link at the top where it says pricing, which I know is a really strange title for a page, but this is the community I was talking about. So you can join us, premium content, free. You get access to different articles, posts, health quizzes, access to the monthly newsletter, and then there's the gold and diamond subscription if you want something a bit deeper. So that's the link I've put in the chat for people to just to follow the link and then just subscribe to the newsletter. And yeah, like I said, I'm hoping to grow us to 1,000 before the end of this year. Very ambitious target. Okay, so yeah, that's that link. Right, so we've dealt with that question. Before we tackle the next one, hello to Vero Kwashi. Thank you so much for putting your question in. You're welcome. Where are you watching from? Pop it in the chat. Thank you so much. Give this video a like as well. Great to have you on board for this live Q&A, the very first Q&A of the year. First of many. Anyway, so Vero's saying to us, please, what does it mean when your menses stop coming for like 5 months now and you're not pregnant as well? So well, I have a dedicated video on this channel talking about the causes of absent menses, because there's quite a number, Vero, so I can't tell you specifically what it means. But possible causes, I can't tell you what it means in your case is what I mean, because every one of us is different. So for yourself, it might be something different. For somebody else, it could be something different. There are different causes, my sister. That's what I mean. So of course, for such a thing, I don't know if you've gone to see your doctor yet. I don't know if you've had a conversation with your doctor to see what could be going on. the different things. For example, imbalance of hormones tends to be around the most common cause. Imbalance of hormones, and that imbalance of hormones can happen for many different reasons. I don't know if you've heard of a condition, excuse me, I don't know if you've heard of a condition called polycystic ovary syndrome, where there is hormone imbalance because there are different hormones that are not behaving the way they should. And so a woman is not ovulating, the ovaries are not working the way they should. So there's low estrogen, but then there are other hormones like testosterone and insulin that are also doing what they're not supposed to be doing. And all of this would affect different aspects of a woman's reproductive function. So it could affect things like her ovulation, it can affect things like her fertility as well. And so some women can go for several months without a period. So I'm definitely not saying that you have PCOS. I'm just saying that there are different causes. And unfortunately, this is not something I can assess or diagnose here. I think you need to speak to your doctor. You're very much welcome if you want to use our email health information service on the website that I just shared with you. In fact, that's one other service that the website provides. I forgot to mention that. And we can sort of go into more detail, have a conversation, or at least have a one-to-one conversation around what your circumstance is, what your issues are, and then we can sort of point you in the direction that you can have a conversation with your doctor to consider different possible causes. Okay, so Vero, okay, hi from Ghana. Thank you so much, Vero. So providing a bit more information. So trying to conceive, menses, they keep changing, has to do with your hormones. Yeah, I mean, like I said, that's just one reason. That's just one reason that we could use to explain absent periods when you're not pregnant. There are other things like medication, but hormone imbalance is just one of them. And like I said, I do have a video on my channel where I can't remember whether it was last year or so, but there is a video. And if I remember after this, then I'll put the link as well so that you can have a look on that. Or you could just go through the video and just sort of search for, go through the list. I think there's a playlist. I have a playlist on the channel that talks about menstrual things. So it will probably be in that particular playlist. So again, I think it's worthwhile to sort of sit down. If you're sitting down with your doctor, for them they've examined you, they've done the tests, which hormones are the issue, what is the diagnosis that they have you done, what kind of tests have been done, and then that will provide you the guidance that you need. They will provide you with what options are best available to you. So I hope that you can do that. But like I said, if you need more clarity on what potential causes, what the potential cause could be, I think that video will be quite useful to go through for you. Okay, so we've done 3 questions. I think we can take one more before we take a short break. Let me just have a quick sip of my drink here. And oh, hi. Hi, it's been nice to see you again. Happy New Year, my sister. Happy New Year. Thank you so much for popping in again. Good to see you. I wish you and the family the best for the coming year as well. Always great to see you. Thank you so much for supporting the channel. It's good to see you. I hope you had a good Christmas, or at least a good Christmas break. And yeah, we're so thankful to God that we've been able to get into another year, and then just looking forward to the great things that the year has ahead for us. So you're very much welcome. Okay, so let's see if we can take one more question before we take another break. So this is an interesting one. Is this the whole question? Let me just have a quick look. Is that yeah, okay. You guys have the whole question on the screen. So it says, ever since I got pregnant, a huge bump developed around my labia. I've read this can happen during pregnancy. Should I wait until after delivery to treat it, or will it clear up on its own? Okay, so that's an interesting question. I mean, obviously, this is something that I know that this poster is just looking for extra information. This this is a conversation that she really should be having with her midwife and her doctor. And many times, if a condition is unlikely to give any significant problem to both you and the baby, your clinical team would like to leave things alone until after you've had the baby, unless it's going to cause any significant harm to you or the baby. So generally, if it's not going to cause any problem, they would say leave it alone. But this is around the labia, so I don't know, when she says huge, I don't know how huge it is, because you don't want something that during labor might cause an obstruction when the baby's coming through. But she says, I've read it can clear up during pregnancy. Should I wait until after delivery to treat it, or will it clear up on its own? Now, if it's so different things that when you're pregnant that could arise, different bumps or even swelling. I think in one of my videos I talked about how women can develop something called vulvar varicose veins, simply because of the pregnancy and because of the pressure, for different reasons. One of them being, I beg your pardon, scratchy throat tonight. So vulvar varicose veins can develop because of different things, like the pressure of the bump of the growing baby on the blood vessels around the pelvis that supply the vulval area. So you might have a little bit a swelling of that area. It might come as a lump or a bump, or the general area just appears swollen. And it could also happen, of course, because of the blood flow that has become greater or higher, simply because you're pregnant. So varicose veins, the same type of varicose veins that people get in their leg, they could develop those in the vulval area during pregnancy, and it does settle down after you've had the baby. And again, it's one of those things that when your doctor, your clinical team have examined and they're happy with what it appears to be, they would usually not do anything unless it could cause any harm to you or the baby. And the other possibility is something like a cyst. A cyst, again, if I didn't describe it earlier, just tends to be a swelling of tissue in a particular part of the body, and it could happen anywhere. So it could be a cyst that's just developed because of hormone changes or because of the effect of those hormones on the skin, and it could just cause a cyst to develop. Not necessarily a Bartholin cyst or a Skene's gland cyst that we're talking about before, but just a simple cyst that's developed as a result of the pregnancy hormones. Now, a lot of these could settle after the baby has come, and when your hormone levels come back to normal, the baby bump has settled and all that. But if it's causing problems, if it's getting bigger, if it's causing pain, then it needs to be checked by your doctor. And I think it's good practice, because she said it's huge. Again, what is huge? I think if it's so large that she's something that, most of us would consider huge, I think it's something that, you should have a conversation with your care team about, so they can have a look at that for you and advice. But again, if they have a look at it and they're not worried and they think, let's leave it alone, it's probably likely that it's not going to cause any harm. It might even settle down itself after you've had the baby and things go, back to normal. Okay, so guys, we're going to take another quick break. And, if you've got any questions or comments, again, we're talking about vulval vaginal lumps and then fibroids. We're going to be looking at fibroids pretty shortly, and pop them in the chat or the comment section. It's our very first live Q&A of the year. I'm really excited to be up with you guys tonight. And thank you so much to those that have joined, asked questions, that are watching. Please don't forget to like the video. It's much appreciated. I really appreciate your engagement over the last year, and I'm hoping that we can see much more of that. Okay, so let me take a quick break, and we shall go on to our next questions. Okay, welcome back. Thank you so much for joining me today. So let's go on to our very next question. And we're switching over to fibroids now. So I think we've gone through quite a few actually. So this was on the back of a fibroids video. I think we're actually discussing natural fibroids treatment, and this came on the back of that particular video, which was quite interesting. So somebody wanted to say, after fibroid surgery, how many days do you spend in the hospital after surgery? Do you bleed like C-section bleeding after surgery? Do you have constipation after surgery? What do you do to help? So many questions in one. Thank you for that question. Thank you so much to the viewer who sent in that question. I think I responded. I want to believe I responded. Honestly, if I didn't, I'm making a mental note. I will check and just make sure that I've responded. Sometimes there's a lot of questions. I do try and go through and answer as many as I can. Sometimes there's quite a few, so I may not get to them as soon as soon as you would like, or as soon as I would like, but I do try to get to them. So let us assume, because again, we don't know, this is all the information that they've provided to me. Let us assume that this is after a myomectomy, for example. There are different types of fibroid procedures. Again, we have 2 playlists on this channel, and they are each of them is more than 20 videos long, containing conversations around fibroids. So please check those out. But it depends really on the type of surgery. So for example, if it is a myomectomy and it is a laparoscopic myomectomy, which is where that's minimally invasive, what they've used some tools to cut into the abdomen, using very small cuts into the abdomen. So you don't have a big cut that opens up the abdomen. You have a small cut through which tools are introduced, including a camera that allows the specialists or the surgeons to see the inside of the abdomen and then deal with the fibroid. So that's a minimally invasive procedure. You're not likely to spend too much time in the hospital, maybe 1 or 2 days. But if it is the other one, where you have open abdominal surgery, where a wide cut is made into the abdomen and the abdomen is opened up in order to see the womb, you might need to have a longer stay in hospital. So it varies, is the answer to that question. Now, what about bleeding? Now, with a surgeon who is with a very experienced team, bleeding can be very minimal, or not as heavy as with bleeding after a C-section. And I hesitate a little bit because I'm originally from Nigeria, and I am familiar with a lot of concerns about fibroid surgery being related to heavy bleeding after the operation. Particularly because with fibroids and with very large fibroids, there's increased blood supply to the womb and to the fibroid. So if the surgery, if the cuts and if the repair after the fibroid is removed are not managed properly, there can be a horrendous amount of bleeding that could potentially become fatal. So I'm just trying to be very careful with that. And if it's carried out by an experienced team and, conscientious team, being very careful about where they've put their knives and where they've put their needles and how well they've repaired the cuts or any cuts to the womb to remove the fibroid, then I don't expect that you'd have as much bleeding as postpartum. Because after you've had the baby, one of the things that's happening is the placenta comes away after the baby has been delivered. And so you're going to have the part of the womb lining will continue to shed day by day in bits and bits as the hormone levels of pregnancy fall. So daily, a woman will lose a bit of blood. It lessens. It's called lochia because it's usually blood actually mixed with other sort of products post delivery, and the womb is just trying to empty and clear itself really from the pregnancy. So women tend to have a bit more bleeding, which settles as the days, as by 1 to 2 weeks for many women. The bleeding tends to settle by the time they are sort of 4 weeks, and they probably maybe perfectly dry. So if we're sort of to compare head to head, where do you experience more bleeding after the surgery? I would expect that when you have removed the fibroids that are responsible for any heavy bleeding that you experienced, then your bleeding should settle down. If the surgery has been performed with a very skilled surgeon who has repaired all the blood vessels, all the areas where the fibroids have been taken out, then I would expect that your tissues should be busy repairing. And I'm not saying there won't be any bleeding at all. It should be light, but it certainly shouldn't be heavy. Compared to what I would expect for somebody who's had a C-section birth, where your body's hormones, the pregnancy hormones, are calming down. They're coming back down to level. The womb is trying to clean itself out. Any bleeding that you expect after a C-section should not be greater than what you'd have compared to, any bleeding that you'd have following a myomectomy should not be greater compared to what you'd have following a C-section. A C-section, of course, that is conducted by somebody who is skilled, who's got experience in the work that they are doing. So I would say, given the fact that a woman would still lose blood, whether she's delivered by C-section or vaginally, her hormone levels are still going to do the same thing. So there will still be a little bit of bleeding that should settle after she's had, after the babies come out, whether it's by vaginal birth or by C-section. So I wouldn't, in terms of responding to that question, I wouldn't be sort of worried or panicking that, do you bleed like a C-section bleeding? There will be some bleeding, but I would not expect, especially if it's been conducted, in the way that it should be, then I wouldn't expect that you carry on bleeding for days and days, which lightens towards the, sort of second or third week after you've had the C-section. So the next point, so the answer to that is no, you don't bleed like a C-section bleeding after surgery. In fact, you might probably bleed less, especially if the fibroids have been taken away, and all the bleeding points where the blood vessels that were supplying the fibroids have been cleanly closed off by your surgeon and your surgical team. And the next question is, do you have constipation after surgery, and what did you do to help? So constipation after surgery is simply related to a couple of different things. How long you're lying down, or how long you're still in bed after surgery, or how quickly you get up and start moving around, which so obviously depends on the type of surgery that you have. But it's common because of that mobility issue, or because of the medication or drugs that you're given. Sometimes the pain medicines that you're given can have side effects of causing constipation. What else? Those are the main things, really. So if you don't spend too much time in recovery, that is having to lie down because of pain or because you had major surgery, then and you get back up on your feet and you're moving around, beg your pardon, and you're moving around, then you're probably less likely to experience constipation. And then, like I said, some of the pain medications, especially those that are morphine-based or opiates or opioid-based, tend to have side effects of causing constipation. So what you can do, because of course you need your painkillers, what you can do is focus on eating really fiber-rich food, taking plenty of fluids, and if you need to, something to keep your stool soft, laxatives to help to soften your stool so that you can go. So I mean, these are part of the sort of post-op questions that your clinical team, your nursing team, your medical team will go through with you. Things to expect as you recover from your surgery, but it's usually something very simple to deal with or to sort out. If you're someone that's prone to it, then already have it at the back of your mind that you're taking lots and lots of fiber, trying to get back up on your feet and doing a bit of exercise pretty much as soon as you're given the okay from your team, and using laxatives if needed. So thank you so much for that question. We've sort of entered the fibroid segment of the stream. So let's tackle another one. And this is, what if the person with fibroid bleeds a lot during her period? What should the person do? So I think that's the whole question. Let me leave it on here for you guys. Let me take a quick look at what's going on with the poll. So the poll question was, what's your biggest concern about fibroids? And so far I've got 17 votes. Thank you guys for voting. And I have heavy bleeding 24%, fertility 47%, and other symptoms 29%. So leading is fertility is the biggest concern about fibroids. Leading at 47%. So nearly half of our votes actually. And it's interesting because I had one of our guests last year? One of our guests was my friend and my colleague, Dr. Tolu, who's a gynecologist, who came to talk to us about fibroids. I think it was August. We were doing Fibroids Awareness Month, and she hopped in a couple of our live streams. I think she sort of mentioned, we had a conversation about the effects of fibroids. And while fertility is certainly one of the possible complications, it's actually not as common. Of course, it depends on a whole lot of different things. Whether a woman who has fibroids will have fertility issues, that depends on so many things. Of course, the size, the position of the fibroids, and so on. But do you know, one of the things that I think many people might be surprised to hear when somebody comes and says fertility problems and they have fibroids, your gynecological team will make sure they assess you thoroughly. They won't just assume that the fertility issues are down to the fibroids only. Like I said, it depends on the type of fibroids, because there are many women who have fibroids, okay, and don't have any symptoms. They don't have issues with fertility. So it's an individual thing, but I certainly appreciate the concern. I think that's really interesting, that feedback that we're getting from the poll. Hi, lovers of animals. Hello. Thank you so much for joining. Welcome. Where are you watching from? And they say hit the like button. I know, hit the like button, guys. Thank you so much for that reminder. I appreciate that. Where are you watching from? Thank you so much for joining the stream. You are welcome. Right, so we were on to this question. What if the person with fibroids bleeds a lot during her period? So it's definitely a possibility. Some women with fibroids will bleed a lot, very heavily during the period, and even outside of the period, thanks to the effect of hormones, but also thanks to the effect of the fibroids that change. They stretch out the womb, so the area where potentially bleeding can come from is bigger, more blood flow, to the muscle because of the fibroids growing, so they can bleed. So it's not unusual, and that's heavy bleeding. It's a very common symptom. It can lead to low blood levels. That is, you're anemic because you're losing blood. So when I say low blood levels, I mean, in your body, when we do a blood test, your hemoglobin levels are low. So if this is not treated, if you don't pay attention to this can cause a lot of problems. They're making you feel very tired, lethargic, not able to get on with things, and even go on to cause worse problems if it's not dealt with, So it's really important that if somebody is losing a lot of blood from fibroids, they should have, or from whatever cause, a blood test to find out what is their HB, hemoglobin level. Are they anemic? How bad is it? They need to have treatment of that anemia, because if it's not treated and it continues, it could even affect the heart. It could cause so many other complications. All right, so of course, there are different treatments that can be used to manage the heavy bleeding. Refer you back to my fibroid playlist where we talk about this at length, from simple medication, just simple things. You can have both hormone and non-hormone options, things like tranexamic acid, for example, or even let's start with the simple ones, ibuprofen for some people. And then things like tranexamic acid, then hormonal options, some birth control options, some other type of hormone therapies that can be used to manage the bleeding. Then, of course, there are surgical options to deal with it. One of them is myomectomy that we're just talking about. Another one is uterine fibroid or uterine artery embolization. That are also options. And the options, of course, that a woman chooses depends on her situation. Somebody may have tried anti-inflammatory medicines, tranexamic acid, birth control, other options, other hormone options, or hormone receptor antagonists, and they haven't worked, then they might decide to go for surgery. Some people experience very heavy bleeding. Some people choose to go the natural route and decide to employ things like changing their diet significantly, using certain herbal preparations. Some people have found those have helped them, have worked for them. It tends to vary. I usually would recommend that you sit down with your specialist so that you can have a wide view of what options. Okay, and you can go for a second opinion, because I talk to many women who say, oh, my doctor only said I should have a hysterectomy. A hysterectomy for somebody who is in their mid or late 20s and who has not yet started a family, hysterectomy is not a solution for fibroids. And in fact, I think was it somebody, I'm not sure if it was on the channel or was it somewhere I met somebody and we're having a conversation, and hysterectomy for that category of people is not a solution. In fact, a hysterectomy for somebody who is in their 60s having fibroid related symptoms like heavy bleeding, for example, because it can happen. Hysterectomy is not even the answer, because as somebody said to me, why would I consider losing a part of my body as a cure? And I'm not laughing because of what they said. I'm just laughing at the situation and how you learn every day from people. And sometimes we medical practitioners just say, oh, the cure is this, the hysterectomy is a cure. And it was actually challenging to listen to that lady's experience, who said, no, that's not a cure. I don't consider that to be a cure. But the point I'm trying to make, let's go back to our question before we completely derail. The point I'm trying to make is that there are different treatments, whether it's bleeding a lot during the period or bleeding outside of the period. There are different options. The options can differ from one woman to the next. So each person has to have that sit-down conversation with their practitioner to decide what is best suited for them. Okay, so let us see. So Lovers of Animals says, do you believe bleeding? I think. Please clarify for me so I can make sure. Do you believe this is caused by perms and hair chemicals? I know some lawyers are accepting patients with fibroids and going after these companies. What are your thoughts? So we're going into the realm of endocrine disrupting chemicals. And at the moment, my thinking is we don't know for certain. We don't know for 100%. We're not sure. Because you can say that certain things can be associated with something. That doesn't necessarily mean that they definitely cause the problem. If I used a pin and pricked my finger, then that's definitely a cause. That's clearly a cause. But if I were sort of trying to tidy up my table, which if you could see my table is a mess, and I'm just sort of trying to clean and moving my fingers around the table and sort of just nicked myself on the table, I can't say that it was a pin that caused it. I don't know if that's a very good analogy. But the point I'm trying to make is that we don't know all the things that cause fibroids. We suspect that there is a lot to do with a person's lifestyle, person's weight, the type of food that they eat, estrogen and progesterone imbalance, the question of endocrine disrupting chemicals, which you find in all these perms and hair chemicals. All of these, we think, factor into how somebody developed fibroids. Can we specifically say that it is the hair chemical and the perm that caused the fibroids? We can't say that at this point, today, 12th January 2025. We can suspect. We should do more tests. We need more research to help us work out. Because what about the women who've used these perms and hair chemicals that didn't get fibroids? So that's why you can talk of an association, but you can't say there's a definite cause at this point. I mean, I'm happy to be corrected if 1 or 2 years down the line, we have new data, we have new evidence that tells us something different. So that's my thinking. I mean, lawyers would hear the take the cases to court, and that's an opportunity to have the conversation. That's the opportunity to bring the data out and review what we know. And where that's going to go, I don't know. I'm going to watch that with interest because if you're someone that's regular on my channel, then we talk a lot about fibroids. Yeah, thank you so much. Nice to see you watching from New York City. And you said you have to take vitamin D pills every week. Yeah, fibroids caused by chemicals and hair perm. So yeah, lovers of animals. I'm going to follow up that story. And I think there's nothing wrong with asking the question. I think we should ask the question. There are many of these preparations, creams, and all sorts of things that were thought to be safe years ago, and all of a sudden new information is coming out. I don't know if you're aware, and it was one of my viewers, my commenters like you, that sort of pointed me to this. I don't know if you're aware about the association between the depot shot, depot progesterone shot, and brain tumor, meningioma. Which is something that is gaining more visibility. And so somebody shared something on my channel recently, and when I had a look, then I realized that a number of lawyers are suing the manufacturer of the depot shot, I think both in the US and Australia. For now, I'm still researching this subject because I intend to sort of do a really deep dive into this when I have a lot of the information to put together into a coherent video, because I'm interested. I know my patients and people will soon start asking, so what should we do? Should we stop taking this? Now, by no means are we saying that the depot shot, I'm not saying that the depot progesterone shot causes a meningioma, but what we do have is a study that was published in the British Medical Journal last year, indicating that there was a strong association, or that there is a strong association or an increased risk of developing a meningioma, which is a benign type of brain tumor, for some women on the depot shot. And it goes again to that comparison I was trying to make, that being associated with something or having an increased risk doesn't necessarily mean that it is that thing that specifically caused it. And the reason that the manufacturer is being taken to court is because they were silent about this. They did not disclose. That's the problem. The problem isn't, that this drug causes this. No, the problem is that people were not informed. So that's something that I really want to watch. That sub conversation I really want to watch. And I'm going to keep an eye on this one, as you've mentioned, where the lawyers get to and where the conversation goes. But for now, I think just based on the evidence we have, the research that we have, based on that, we can't say that these perms cause fibroids. But I would say, I'd think of different things. I would say if somebody has a family history of fibroids, if somebody already has fibroids and you're looking at how do I reduce my risk of them growing, how do I stop them shrinking, then there's nothing wrong with saying I'm not going to use perms or those kind of chemical relaxers. There's nothing wrong with taking those precautions, simply because we do know that endocrine disrupting chemicals may have something to do with their development. It makes sense. But let's continue to ask the question. You're welcome. Thank you, lovers of animals. So let's see. Welcome, Ability. Thank you so much for joining. Hi, where are you watching from? I just want to know where people are watching from. I'm just curious. Anyways, Ability says, I have experience of heavy bleeding during my period last month with blood clots. This was just after I took cloves water for 4 days. Bleeding took 3 weeks. Was this maybe shrinking fibroid? I don't know. My darling. I can't say that it was, because we don't really have any, apart from, okay, your symptoms are getting better, to say that this is what is shrinking your fibroid. The way that we would know categorically that there's any change in your fibroid is if you have a scan. A scan will tell you this is the size of the fibroid today. And then if you do the scan after 3 or 4 weeks, this is the size of the fibroid now. Unless you're experiencing less pain or less bloating or less bleeding, those are other things that suggest, okay, there's some difference, and then that could alert your doctors to do the scan to confirm. So yeah, you said you took clove water for 4 days, bleeding took 3 weeks. I can't say. I'm sorry, I can't say. I'm not able to answer that. So sorry if I couldn't help, but I can't really say much more than that. And you're watching from Namibia. Oh, amazing! You're welcome. Thank you so much for watching. It's good to have you. Good to have you. Okay, so we're going to do a couple more we're going to do a couple more questions. Before I go back, so Vera says, is myomectomy the best surgical procedure for those who haven't had children before? If yes, how many children can you have after the procedure? That's a good question. That's a good question. And in terms of what we have available now, surgical, then for somebody who has fibroids, and if it is felt that the fibroid may affect the ability to have children, then yes, myomectomy is the best option. And you remember that you can have myomectomy either as a laparotomy, so they don't have to open up the entire abdomen. So they just, and that's better because you recover quicker, there's less risk of infection, less complication, and so on. So if they can treat it that way, and again, it depends on you, it depends on the type of fibroid, but that is the best option for somebody, the surgical option. So you have to be very careful because we're using surgery. Surgical option, I would say myomectomy. Things like uterine fibroid embolization, we're still trying to work out data. It's not recommended for somebody who still wants to have children, because we're not 100% sure. I know that those that support the procedure say, oh yes, women can still have children, but unless the literature has changed since I read it maybe last 6 months ago or so, it's not usually recommended if you want to have children. So you can have it as a treatment to control symptoms of bleeding. That's uterine fibroid embolization. But if you're actively wanting that, look, I want to have kids and we want to remove the fibroids, then usually it's a myomectomy that'll be recommended for you. And if yes, how many children can you have after the procedure? I can't say that. What I will say is, and this is from my colleague who's a gynecologist, and what I've observed as well is fibroids can come back even after myomectomy surgery. And my last reading, as I recall, you're looking at within 12 to 18 months of the surgery. So some doctors or some surgeons will say to you, some gynecologists will say to you, well, are you ready to have the baby in the next 2-3 years? Then let's do the surgery so that you recover and straight away start trying for the baby. Now, the fibroid might not come back for over a year, so that you at that point you can have your baby, recover. The fibroid might still not come back. Again, we don't know what it is from one person to another person that increases the risk of fibroids, apart from things like diet. We talk about being overweight, we talk about the influence of red meat, we talk about smoking. What are the other things? Issues that you can control that could potentially increase your risk of developing fibroids are some of the things I've mentioned. So I can't say to you, that you can have 4 kids after having fibroids, because yeah, you can, but I don't know that for certain. What I know is that you can have your myomectomy and recover from the myomectomy, have your baby. If you're still fibroid free and you're ready to have the next baby, of course, go ahead and have the baby. So you could have that experience and have 5, 6, 7 kids and the fibroids don't come back. But for some other women, they might have their first child and then the fibroid comes back, or the fibroid comes back and it's not so large to cause any problems and they have another child. So I don't know if I'm being very clear. It's not something that it's not something that a person can forecast. Okay, what we can say is, if you want to have your child, have that conversation with your specialist, look at the myomectomy surgery and other options that they discuss with you, and then plan, focus on being well in yourself, focus on recovering from the surgery, from the procedure, and then starting your family, and then, see how things go after that. It's not something that one can just predict how many kids you can have after the procedure. So I hope that helps. I will take one more comment because I really want to go through the rest of the questions that we have. So Lovers of Namibia says, what are the chances of fibroids returning after treatment? It's possible. Okay, I don't know the chances specifically. I don't know the chances specifically in terms of percentage, but the chances of fibroids returning after treatment, like myomectomy, I've just been saying, it is possible. Yeah. And not because you did or you didn't do anything. So don't get me wrong. I don't mean that there's any specific thing that one could do. Some people who do everything, they maintain their weight, they avoid, certain types of food, and they avoid certain types of exposure, and still the fibroid might come back. Some people do exactly the same thing. The fibroid doesn't come back. It's not very clear. Remember that there's still so much that we don't know about fibroids, but at least we know enough to help us. And many, many women have gone on, they've had myomectomy and gone on to have their children, gone on to have a child or other children, many, many women. So I want us to be very optimistic about it. I want us to be focused on the possibilities, because the more that we advance in medicine, the more the more opportunities, the more chances open. So don't let it be something that would, make you frightened. So it says, how likely are fibroids to come back after treatment? I had procedures, UTI, but now it's back after 8 years. I'm not sure what UTI is though. That's urinary tract infection. It's back after 8 years and 48 years. So I don't know if it's you had a procedure and then it's back after 8 years. So yeah, it varies. For some people, it comes back after 18 months. So 8 years is quite a good stretch to be free of fibroids. Okay, guys, so let me let's go on to the next questions, so that I think we've not got those, not too many actually, but I want to make sure we go through them. All right, so if we shrink it naturally, will it still become cancerous when we grow older? And really thank you so much, guys, for the engagement in the chat. I appreciated the questions. Please don't forget to give the video a like. That would be so much appreciated. Okay, so this question I've got on the screen now is referring to fibroids, treating fibroids naturally. And somebody posed a really interesting question and said, if we shrink the fibroid naturally, will it still become cancerous when we grow older? That sounds interesting. Well, in the first instance, as we know, fibroids are benign, so they're not cancerous tumors. They're mainly benign. The chance that they can become cancerous is very, very rare, really very rare. So shrinking them, whether you're shrinking them naturally or through medical means like using any medication or uterine fibroid embolization, doesn't affect the chance of cancer. But I think what's important, and this is what we say, even to ladies who have fibroids and they don't even cause them symptoms, we encourage regular monitoring, because you want to check that there's nothing changing. And, you have a conversation with your doctor, because that might be having regular scans or just, reviewing your symptoms or reviewing your condition, just to make sure that nothing has changed. But yeah, I think the answer to this is very, very unlikely. It's unlikely that it will become cancerous as you grow older, is what I would say. Okay, so let's just quickly pop back into the chat. I see a lot of, okay. So Lovers of Animals says, I had uterine embolization. Okay, so you had that, UFE, and then after 8 years, it came back. Yeah, fair enough, I understand. Yeah. Okay. Yes, it's the same. UAE, UFE are the same. I understand what you mean. So it's uterine artery embolization. Some people call it uterine fibroid embolization. Okay, so let us go to the very next question. So this was another interesting one. And I think in that video, it was not a video dedicated to Chinese medicine, but I was talking about different natural options. But when I saw this question, I thought, wow, perhaps I need to do a video on this. And now I'm talking about it, I've just realized I haven't even included I've not included the clips I wanted to show, because I thought if this person is watching the stream, I would want them to sort of go away with some information. So, all right. So what I did, okay, to be on downloads, all right, should be here. Okay. So I'm just going to load up some stuff. Yeah, so we're talking about natural options for treating fibroids, and they wanted me to clarify what exactly do I mean by Chinese medicine. So first of all, okay, I would not recommend you taking on Chinese medicine without a trained or experienced Chinese medicine practitioner. Because I know there's a lot of stuff on the internet, and they say take this, take that, mix that and that together. I am not a trained Chinese medicine practitioner. And from looking at the data and looking at the research that we have available, I know that there's been a lot of success treating different conditions with Chinese traditional medicine, and that includes different things from acupuncture to dietary changes or the type of diet to different herbal preparations and others. And that's what I was referring to in this particular video that this person was asking about. But I would not say, right, go ahead and take a Chinese herb, because I don't know how much you should have that will be effective for the fibroids. You should rather be under the care of practitioners who are trained in using these things. And I've come across, while I was sort of researching and looking into this, I've come across studies that indicate that actually using Chinese herbs combined with Western medicine, like some of these hormone drugs for treating fibroids or simple anti-inflammatory drugs, actually is more effective than just using the Chinese herbs. There's a lot of interesting, research that's going on. But just for the sake of anybody who might want to know, so some of the Chinese herbs, for example, I'm just showing that on the screen. So we have Chinese herbal preparations, we have acupuncture, and these are the names of the different drugs. I'm not going to embarrass myself or anybody who is Chinese by trying to pronounce the Chinese names, but I've left them here so that you can have a look if you're interested and you want to sort of look into this. Please bear in mind that I'm not proposing that you start taking any of these things. I don't know the doses. I don't know how you take them, how long you take them for. What we have is the data from studies that have been done and that show women with fibroids have gotten some benefits from using these or a combination of different treatments under the guidance of somebody who has the experience and the training, okay? So you have the Chinese herbal preparations and then acupuncture and the different, forms of acupuncture. On the screen now, I have some of those herbs, so that you can, let me just take this banner off first. So you have these herbs like the radix, peonia rubra, peach kernel, panax, noto ginseng, cassia twig or cassia twig, chasteberry, Poria cocos, I think is a type of mushroom. And again, I've got a couple of studies that I thought were quite interesting. So I think what I'll do is I'll try and put all these things together, maybe in a sort of Google document, and I can put the link for anybody who wants to sort of look into this further. Like I said, my advice is it has to be under the guidance of somebody who is experiencing these things, and not just you pick and choose something from eBay or from Etsy or somewhere and start taking them. I would not recommend that at all. And of course, acupuncture as well, and the different or alternative techniques or based on acupuncture, like cupping or electroacupuncture, moxibustion, and what was the other one? The one that the acupoint catgut embedding. These are different therapies that are used in Chinese herbal practice. And that was in response to this question when somebody says, when I mention Chinese medicine, this is what we're speaking of. But my recommendation is that you consult a licensed practitioner. And if you're working with a licensed practitioner, let your primary doctor, your gynecologist know, especially if you're taking herbal treatments, to avoid any interactions. I will say this until I'm tired. Never ever assume that because it's natural or herbal, it's not harmful. Some of these are very strong preparations that can cause liver or kidney damage if they're not taken correctly, or they can interact with other medicines that you're taking. Lovers of animals says, we'd love to know more about traditional medicine. Well, this is the most I'm going to say about it at this point, because I thought somebody was very curious and I thought, let me just elaborate. So like I've said, acupuncture, diet, Chinese herbs, these are just some examples. Of course, exercise. These are some of the things that a traditional Chinese practitioner will go through with you. And of course, having reviewed your symptoms. And these are not just for treating fibroids, actually. These traditional Chinese practice is, centuries old. And there are studies that show, quite interesting results whether those studies can be, whether the same experience can happen for other people, so non-Chinese or in other parts of the world. We need more studies to determine that, because don't forget, we talk about these medical conditions, and sometimes your upbringing or where you live, your environment can be a factor in developing some of these conditions. So all I'm saying is that this particular treatment might be all the very well good for them over in China or in different parts of Asia. When you come to Africa, do we get the same response? Or when we come to Canada or France and so on? So this is what research does. This is what science does. This is why it's good to have these studies, so that we can know when we say, oh, this treatment works or this treatment is effective. Okay, fine, it might work in this particular group of people, but what about the next group of people? So those kind of conversations. Right, so thank you so much, guys. Please don't forget to give this video a like. We are coming close to the end of the stream, but I've really enjoyed tonight. Thank you so much to those who have been working with me, just spending time sharing their thoughts with me. I've got another question, and I'd love to know as well in the comment section, if anybody has tried fibroid treatments, what natural fibroid treatments, please let me know your thoughts. Did it work for you? What was your experience? Not just Chinese, any natural fibroid treatment, because it's quite popular. Many people are thinking about it. Many people are not keen on surgical options or medical options. Let me know. Okay, so one more question. Someone says, I'm taking green tea most of the time. I'm worried my iron pills won't work if I continue drinking tea. This is a fantastic question. And I knew I had this question, but I didn't realize it was coming up at this point. I've just finished talking about don't assume that because something is natural or herbal, it's not going to cause any danger. So this question, I think, just really nicely emphasizes this point for me. Green tea, healthy. Everybody considers that green tea, is, even if you're not a medical practitioner, your understanding of green tea is that it's a healthy or a healthier form of green tea, of drinking tea, because many people, or people generally, will not add milk. Some people can take their green tea without any sugar or sweetener or honey or anything like that. So it's considered to be a healthier form, but not just that, not just in the fact that you don't take things like milk or sugar with it, but the fact that it's known to have anti-inflammatory benefits. It's known to have antioxidant benefits and so on. But the question here specifically is about interfering with iron. So this is what I was saying about it could interfere with some other medicine that you're on. So this is somebody who's on iron pills, and usually we use those to help people who are anemic. So that's a very important treatment. But there's a concern here that the green tea might affect her iron, and she's right, or they're right, because green tea contains compounds that can affect the absorption of iron, whether it's from your food that you're eating or from supplements. So we're not saying that you can't have the two together. What you should do is take them at different times, and that's the advice I will give to this person. And it's not just green tea. There are other, possible combinations of things that, somebody is taking a particular medicine, but we say to them, don't take another substance within a couple of hours, or take this first, and then after a couple of hours, you can have the other thing. So don't take them together. So to maximize the effect of your iron pill, what would I recommend is take it at a different time to when you have your tea. Okay. So you could, if you're going to have your tea in the evenings, then your iron, you'll be taking it at maybe a few hours earlier or during the morning, or whichever way works best for you. And another good idea is to help your iron absorb better. Take it with some vitamin C, or make sure you're taking vitamin C rich foods to help it absorb better. Okay, so guys, wow, what an amazing time. Thank you so much. I really enjoyed this first of our new year, first of our 2025 live streams. It's been amazing chatting with you guys. Thank you so much for being such an engaged audience. I really appreciate the comments. I really appreciate you guys choosing to spend some time. If you have popped a comment in the chat, much appreciated. So thank you so much to all my commenters. There was Sister Zahab, who was joining us from Brooklyn, New York. Excuse me, there was Vero, who was joining us from Vero Kwashi, who was joining us from was Ghana, I believe she said was joining us from Ghana. And there's my old friend, Miss B. Nice to see you again. Thank you so much, lovers of animals. Great to see you. I think you popped something in the chat again. Yes, more fiber-rich foods like fruits, vegetables, whole grains, foods rich in omega. Oh, fantastic. Yes, yes, yes. Yes to everything. Yes to everything, absolutely. Thank you so much, lovers of animals. Hope I'll see you again on another live stream. And thank you so much for joining. I'm just trying to see. Okay, and there was Ability from Namibia. Oh, there was a comment I missed here. Willie Nisi, I don't know if you're still here. Possible for HPV to clear from the body, or does it just go dormant? So that's a very good question. It's just not on the topic list for today, but I will refer you back to a couple of videos I have done on HPV, which are I might link it in the description box actually after we finish this stream. But after a very, very long time, so we're talking about, in terms of genital warts, HPV causing genital warts. So after a very long time, and we're talking about years, it's possible that the virus may clear from the body, but mostly remains dormant. But after a very long time in some people, and we're talking about years, like I said, it might just completely clear from the system, but it takes a very long time. And so what you have more often is that it remains dormant. But according to research that's been done, yes, it is possible that it can completely clear, but it will take a very, very long time to do so. And mostly what tends to happen is that it can, remain dormant in the body. But I think it's something I've addressed in one of the videos. So if you want some more detail on the subject, please do check it out. And thank you so much for dropping the question and for popping into the chat with me. All right, guys. So it's been a great evening. Thank you so much for watching. Thank you so much for commenting, and here's to a great 2025 for everybody. Don't forget our regular uploads are on Thursdays for regular videos, live streams on Sundays, and community post every day. So if you've got a comment or question or something you want to share with us, with me and the community, please feel free to do so through either of any of those channels. And of course, check out our website. I shared the website with you guys earlier. So of course you can see that in the replay. You can reach me for different issues, via the email health information service, via the digital concierge. There's a free symptom checker tool. There's a newsletter. So many ways that we can sort of connect and, speak about different issues and learn more, help ourselves get healthy together. All right, my friends, thank you so much. Take care. I will see you again soon. Bye-bye. Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below. Before you watch this video, please like and subscribe to the channel so we can continue this health journey together. So, let's get started. I'll see you in the rest of the video.